You're on.
Okay, well, good morning, everybody. Welcome to our special city council meeting. Today is Friday, May 22nd, 2020. It's approximately 9:30 a.m. Before we begin, if you please join me in the Pledge of Allegiance, please. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so before we begin, I don't know if you've noticed, but we have a guest, Commissioner Manny Sanchez. Thank you for joining us, Commissioner.
Good morning, Mayor. Thank you for the invite.
Sure. And first item we're going to have is going to be the conflict of interest statement. This is where I'll ask if any member of the city staff, city manager's office, or city council has any known conflict of interest on any item on the agenda.
None.
Yeah.
Now, one of the things that I invited the commissioner, and let me just ask you this, Commissioner, would you have a problem if we were to switch the agenda item and go to this resolution that we wanted to discuss? Because I know Mayor Perea has a meeting that he's still in, but if you're, crunch for time, can you share that with us? If you could stay, if that would pose a problem, if we were to move the item a little bit longer instead of right now.
I don't think it'll cause too much of an issue. I have another meeting, but depending on what time the conversation is, I may not be at either at the beginning or towards the end of it. But I think if you move the agenda item, that's fine, and then I'll just keep on the meeting, and
I'm guessing
I'll try to jump in when I can.
I'm guessing 10. Yes.
Sorry, Mayor, to interrupt, but Mayor Perea from Sunland Park was just admitted to the conference room.
Oh, fantastic. Okay.
So he's on now.
Oh, great. Okay. Well, how you doing there, Mayor Perea? I'm just going to assume you said hello. Oh, there you are. How you doing there, Mayor?
It looks like he's still trying to connect with audio. So.
Okay, good. And then what about Mayor Trujillo? Did she make it from Anthony?
Not
Mayor,
that I didn't know.
This is Interim City Manager David Maestas. Mayor Trujillo was also going to be a little late, and that was the reason for your discussion about the potential for moving the agenda item up, and then waiting for her to be able to attend later on and be part of the discussion with the mayor group and county commissioner. Okay.
Well, thank you, David. I think in light of things, I guess we'll just go ahead and leave it as is. Commissioner Sanchez is here, and then Mayor Perea. Yesterday when I spoke with Mayor Trujillo, the good news is there seems to be no outbreaks in Anthony, but nonetheless, I mean, something that was similar to the meatpacking place there in Santa Teresa, Sunland Park area. So let's just go ahead and begin that discussion. Mayor Perea, did you get your audio working? Not yet?
I have. I'm just, I'm running two meetings at the same time right now.
Oh, okay. All right. Well, let me just start off with my colleagues and we thank you and Commissioner Sanchez for joining us. One of the things that we were discussing last week was we want to hear from you all to see what we can do to help you all. If you need any help from City of Las Cruces in dealing with COVID-19, basically that's really what we wanted to discuss with you all. And then I'll leave it up to my colleagues if they want to chime in and if there was anything specific they wanted to ask of you.
Mr. Mayor, if I may say something real quick,
sure, of course.
I don't know context. I think
and if I may also, Councilor Bencomo, I have to admit I was lax lately with our meetings, but I did not realize that when the minutes are being transcribed, they're not necessarily looking at our video. So if you would please mention who you are, even though I know you, but again, they're not looking at the video when they're transcribing the minutes. And so each time you say something, if you please either raise your hand and I'll recognize you. So, Councilor Bencomo, and so that the person transcribing the minutes knows who it is. Because last time I just took it for granted they were watching the video. No, they're not. So sorry about that, Councilor Bencomo. Please, you've got the floor.
Thank you, Mayor. Yes, this is Councilor Bencomo. And I'm really glad to see Mayor Perea and Commissioner Sanchez here. I hope Mayor Trujillo joins us as well. Honestly, this is something that a couple of us had asked for, a joint meeting with you all, because it just felt critically important. I think, to me, as we discuss numbers, the cases for COVID-19 in the city and in the county, to me, I think it's naive to feel like we're somehow isolated, that Las Cruces is its own little world, and that the rest of the county is its own world, and that we're not impacted by each other's actions, when we really are. And I want to make sure that we have a conversation about how to best support each other. I think, Mayor Perea, for sure, I think, things in the southern part of the county are a little scary, and I want to be able to provide as much support as possible and to hear from you directly. And similarly with you, Commissioner Sanchez. I hope that provides some context. I just wanted us to have a conversation about how deeply intertwined we are, and how we can support each other.
Thank you, Councilor. Mayor Perea?
Thank you, Mr. Mayor, and thank you, Councilor Bencomo. First of all, thank you for the invitation to this meeting. And I'm happy to see that other elected officials also recognize the fact that—
Excuse me, for the record, that's Mayor Perea speaking.
But recognize the fact that we are all one community, and recognize the fact that this virus is not knowing the boundaries that we have established as jurisdictions. But with the city of Sunland Park being El Paso, it's just feet away from City Hall, where I'm at right now. Our reality is slightly different from the rest of the state of New Mexico. Juarez, Mexico, has a population of more than 1.5 million people, and El Paso with 800,000. Whatever happens in both those communities is going to affect the city of Sunland Park directly. But it's kind of difficult to also being able to control what's happening in the other states, or in Texas and Juarez, when our jurisdictions are limited. So I think one of the things that could help us down here is going to be increased public service announcements within the city of Sunland Park. I know earlier on, I believe we worked with the city of Las Cruces, and I guess we did a little recording, and I think some of the other elected officials did some as well. Help with that particular platform to show that we have a unified message, I think, would help us on our end. But we have been in communication with the Department of Health, and we're trying to get increased testing within the city of Sunland Park, so that when the cases do come up, we can isolate them as soon as possible. And that's where it's complicated, because the majority of the people who work in Sunland Park are from El Paso, Texas, and the majority of people who live in Sunland Park work in El Paso, Texas. So I to be honest, I'm out of ideas in some situations, but I think that the best thing that we can do is increase the testing and be able to try to isolate the cases as soon as they come up, and do as much community tracing as possible. That's where I stand at this point. I'm open to discussion. Thank you, Mr. Mayor.
Thank you, Mayor Perea. Mayor Pro Tem Gandara.
Thank you, Mayor. Thank you for your comments, Mayor Perea, and for your participation. I got towards half of the meeting yesterday, joint meeting that Commissioner Sanchez put together. Mayor and I halved that meeting, so to speak. And so, I offered our help, our assistance in any way, any shape or form, and you just name it. I think I've been concerned because I know many of us are having communications with the governor's office. And, essentially, as Manny put it to me yesterday, we sort of as Doña Ana County got called out, right? The concern about the numbers of new cases, some being at Stampede, some being from New Mexico State, others being from the Otero Processing Center. And so I agree that a unified message with all of us that and PSAs across the county, because one of the things that I continue to be deeply concerned about is this idea that the governor could shut us down. And there have been discussions, at least from my point of view, or the discussions I've had, having those discussions with the governors, and it's a reality. And I felt almost like our hands were tied because I didn't have a relationship with you, and you know, it's something unprecedented. We don't have those kind of communications with each other, and so to Councilor Bencomo's point and credit, a few of us felt like this was important to have the joint meeting. And what I said at that joint meeting yesterday, and also to the mayor's meeting that I sat in for mayor and the first 30 minutes of, I asked that they ask the questions about increased testing, tracing and tracking, antibody testing, how important those three elements are as we continue to open up. But I know that Mayor Higashima has a working relationship with Mayor Margot in El Paso, and maybe that's where maybe those conversations have been had. I don't know, but how can we collectively work together? And one area was the mask. We have an emergency proclamation with the mask, but I think, as I understand, Mayor Higashima, you felt like the governor's mandate was enough. And I'd like to, again, it felt like the majority of the people on that call yesterday with our Doña Ana County delegation felt it important to do a mask resolution / ordinance. And I'd like to continue to do that. I was a little confused because we had talked about a mass resolution ordinance, if you will, and it sort of got put on the back burner awaiting the governor's sort of her mandate, so that ours mirrored similarly to it. And Mayor Higashima, I understand that you weren't completely sold on the idea. And so I'd like to bring that back up. I think that's an important thing that we do as a Doña Ana County delegation. Maybe it's more symbolic, but maybe it's about bringing more attention to the fact of what mass using science does. And what I heard yesterday is many of our smaller communities are having great difficulties getting masks, having the kind of testing that is necessary to really get our hands around what truly is, you know, the numbers, the true numbers. So, Mayor Perea, I like the idea of for sure the PSAs, and if we can help to do that, we had a campaign to that, but I think we had asked as counselors to do it, you know, probably a different kind of PSA involving all of us. And lastly, the last thing I asked was for a lab here. I think it's important to process those tests quickly. The turnaround period is so important to people so they can get about their business, right? Because they will have to be quarantined. Many of them are losing hours and not getting paid. And when we're having trouble reporting back to people 14 days, 3 weeks. And those are some of the examples that I'm hearing. And so if we can all work together, and Mayor, I suggested a letter from the Doña Ana County delegation asking for these types of resources and that they be expedited. maybe we need to have the medical corps come and set up at Sunland Park to help us manage what's going on in terms of the stampede and just giving us more medical feedback as we continue to make these policies. Thank you, Mayor.
Sure. Thank you, Mayor Pro Tem. So if I may respond to a few things here. So first, let me just tell you the kind of the chronologue, how things happen. Okay, so a while back, a couple weeks ago, Councilor Beta Stuvey wanted to discuss about overall using masks throughout the entire city. Around the same time, I had proposed just City Hall and city facilities. So at that time, the governor hadn't put through her mandate. So anyway, so let's fast forward a little bit. I still move forward with the emergency proclamation requiring face masks at City Hall and city facilities. Governor still hadn't put out her directive yet. So I moved forward. Plus, it was a little bit easier for us to mandate and use our own city ordinance. Later on in the day, the governor put out her proclamation. And so, in my opinion, I felt that was adequate, that pretty much addressed what Councilor Beta Stuvey had to say. So if you'd like, at our next agenda setting meeting, I'll put that forward if you want to move to go to an overall requirement. But I'll tell you that I'm not supportive of that, since the governor already has that. I am okay obviously with City Hall and city facilities. I don't think it's enforceable. I don't think it would be extremely unenforceable to do. Just on my way here to my office, I saw people, even in our multi-use path, which is a city facility, they weren't wearing it. To try to do that overall in the entire city, it can be extremely difficult. But like I said, the governor already has hers. But in all fairness to council members, I'll put it on the agenda for discussion for a first read, and we'll go from there. Oh, and then also, as far as the testing. So, and I know Councilor Sorge brought it up, and I had told you about a lab. So I reached out to this gentleman, and he said that their instrument was approved by the FDA on the past Friday. They've started testing for hospitals. At that time, he said today, which was last Monday. So it says we're working with the governor to secure a more robust supply of chain of reagents. We got our first test in the lab this afternoon and processing now. Mountain View should be very stable with testing. We also reached out today to Memorial and offered to help them after seeing their notice that they are doing limited testing now due to supply chain concerns. So, and I said, okay, that's good. See, I just took it for granted it was someone could go in there, but no, it's to help. It's a laboratory to help with the collection. To help with the testing. So that'll turn it around within, I think 24 to 48 hours, as opposed to sending it to Albuquerque. So the testing is there, and then those were my comments on the face coverings.
Thank you, Mayor. I appreciate that follow-up. Again, we were talking about it since the inception of the pandemic, and really, in my opinion, not getting sort of the reaction that I felt that it needed. And so I'm glad to hear that they've been approved to go ahead and start processing that. And so I'm assuming that Department of Health that is providing a lot of the testing down south will then use this facility, or will they use, I guess, and I know that's not a question for you, but David Maestas, I hope that you can follow up to see that the Department of Health that is providing the testing down south, that they're able to use the lab here centrally rather than having to send that up to Albuquerque would be a question. Again, I'm worried about the timeliness of these testing, and not only for those that are testing positive, but those are testing negative. The mental health, the anguish that people are having to endure while waiting is probably at an all-time high. And so I want to make sure that that happens quickly. Mayor, and just for, I thought that the multi-use path is an exercise path, and it is not required to use a mask. And so I just wanted to say that. And for me, when I indicated, I understand the enforcement could be a nightmare, but again, hearing Chief Gallagher speak to it, asking for voluntary compliance, issuing maybe out a mask when having them available, bringing awareness, that whole idea of just the education that is required, I think is important. So there are a lot of stores and different businesses that are really compliant and actually doing an excellent job, not allowing people to come in if they don't have a mask. And so I just think those are important things, be it symbolic, but also that we are truly one county trying to do everything that we can to ensure that we're ready to open up. And as our peak, and this is where I think we are at, our peak and our surge, we'll continue to get the cases, but at least the governor knows that we're jointly working towards solutions and strategies, and I think that's important.
Yeah, thank you, Mayor Pro Tem. Let me just ask you two questions. One, I don't want to put words in the chief's mouth, but also you also mentioned about how if police officers start stopping and even handing out masks, and now we're having them interact with the public more so than what's really necessary. But that's one thing. But the other thing I just wanted to ask you, when you said you've had some discussion, or they had some discussions about shutting down our county, who said that?
Mayor, it was our government liaison, Victor Reyes. We've had conversations about the increases in our cases, and yes, it's a possibility. He didn't say verbatim that this is what they're thinking, but they alluded to it. And so I think it's a possibility, and we have to. It's our reality. And
well, I understand that, and I just texted the governor because she's never even so much as hinted that to me, and I would have appreciated it come from her than Victor Reyes alluding to it. So I'm just letting you know. So we'll find out if she texts me back before the end of our meeting. Councilor Vasquez.
Thank you, Mayor, and welcome, Mayor Perea and Commissioner Sanchez. Good to see you. So first is, I do support a city ordinance to enforce the mask, I think, according with the governor's guidelines, right? She set a couple of guidelines to where city residents are required to wear masks and where they're not. Eating establishments or being outside doing exercise, you don't have to wear it, or for health reasons, that kind of thing. So I think we should mirror the governor's ordinance. I was at the store, I was at Walmart not too long ago, and there's a big folding sign that says, by the state order, you're required to wear a mask inside this establishment. And I'd say about 20% of the people inside the store, maybe more, were not wearing masks despite that giant sign. And I don't want to make any assumptions, but I think some were honestly openly defiant to wearing the masks, right? And so I know we talked about this before in terms of what happens when there's a potential confrontation, somebody just refuses to wear a mask, right? They're not going to call, state police isn't going to come to address a complaint from a resident saying that somebody's not wearing a mask at Walmart. However, we do have local police officers, if I'm not mistaken, still at every Walmart, At least I see them there all the time. And so I think having the local enforcement, or the option to have local enforcement, although we do want to encourage voluntary compliance, I think is an important thing to have, especially when that's punishable by a fine or some other mechanism for accountability. I also believe that we need to invest in providing masks. Walmart should really be having masks at the front of the store as cheap and reusable or whatever as they can produce them. They are Walmart. I'm sure China's cranking these things out and they can source the heck out of these things. But for folks who truly don't, who maybe forget a mask and still want to go into the store, or who just don't have a mask, maybe their mask is in the washer, I don't know, whatever excuse they might have. If we want truly compliance and we want the best health outcomes, I think these big box stores need to have masks available to the public when they come in. And however we can do that, I don't know what type of investment that might require from the city if the corporations don't want to do that. Because as we talk about reopening, and we are on a course to reopening, right, in phases, and the governor has mentioned that, I think we have to balance that reopening of businesses with maximum compliance with the public health orders. And so the more people that are wearing masks, the easier it is to reopen in phases in terms of lessening our chance for increased contamination. So I think that's something that still needs to be addressed, and I think the local ordinance helps us to get there. But I would like us to have that discussion in addition to the local ordinance of how we provide masks to these big box retail stores. I haven't completely dove into the Descartes lab data that was provided, but I'm willing to bet that that's still probably the big box stores are where the majority of people in close proximity are congregating in the city, considering that's what's open and that's where folks are at. So on that same note, I appreciate Commissioner Sanchez's leadership and his fellow commissioners in requiring that mask ordinance countywide, because that puts us on the same page, right? In terms of all of us as we travel for work or other reasons that are essential, on the same footing. In Sunland Park, in Anthony, in Las Cruces, in Chaparral, right? If we're all in this together, and as elected officials, we say that we value having this ordinance, I think that really helps to enforce that public health order so that we can safely reopen businesses, right? There has to be a compromise. We can't just do it without making sure people are safe. The other part of that, well, in terms
Councilor Vasquez, I don't mean to interrupt, but the chief wants to say something, and then I probably want to let Commissioner Sanchez say something before he leaves, because it's almost 10 o'clock. Is that okay?
Yes.
And then I'll come back to you.
Absolutely, yes.
All right, Chief Gallagher.
Yes, good morning, everyone. This is Chief Gallagher, Las Cruces Police Department. I just wanted to mention that we have procured several thousand masks that our officers that are working at Walmart have available to give out to people as they go in. But there is some confusion with regard, and maybe the city attorney can correct me if I'm wrong. My read of this order does not require face masks in private entities. Walmart is a private entity. It requires face masks in public settings. So the only thing it requires of Walmart is the occupancy standards and to comply with the governor's COVID safe practices for retailers. And that says that they should support the 6-foot social distancing concepts and also encourage customers to wear face coverings, not mandate. I just wanted to clarify that.
Thanks, Chief. And I see Jennifer joining us, or she's been here. But Jennifer, do you want to comment on that?
Yes, thank you, Mayor and Council. Chief Gallagher is correct. There's no mandate to wear a face mask on private property. There are some issues that could be raised by that, but currently it's not a mandate.
Okay, and that was City Attorney Jennifer Vega-Brown. Okay.
Mr. Mayor, are we talking about the state?
Excuse me, Councilor, sorry. I'm going to have to, you're going to be next after Councilor Vasquez, but if you recall, I was going to ask if Councilor Vasquez would allow Commissioner Sanchez to say something before he has to leave.
Just a quick question.
Absolutely.
Commissioner Sanchez? Sorry.
Yeah. No worries.
You want to, the original discussion is how we could help the county, and then we kind of veered off to the face mask, face coverings. But you've got the floor.
Thank you, Mayor. So this is County Commissioner Manny Sanchez. I appreciate the invite, and Mayor and Mayor Pro Tem. I also wanted to say thank you for attending the meeting I had yesterday, as well as Mayor Perea. I think right now, just to kind of give an update really quickly, I know the county has really been working to try to push with PSAs release the requirement or recommendation to wear masks. I want to say the reason I say that is in that way was because I know it's a requirement per the state, the governor's orders. But I know also the county 2 weeks ago, or almost 2 weeks ago, passed a resolution strongly recommending that everybody wear face masks. So what we've done is that we've sent flyers with the Camino Real utilities payments or the bills that went out. We have some flyers that went out both in English and in Spanish. We're also working with El Paso Electric to get that word out to all the customers in Doña Ana County. And so we're really trying, and then as well as using our social media presence, trying to get the word out. So we're going that way. And I think one of the things that one of the items that I think would be a huge help is that we continue to have conversations and we work together with the city of Las Cruces. Yesterday, the meeting that we had yesterday was with the cities of Sunland Park, Anthony, Mesilla, and then I know Hatch was invited, but they weren't able to make it. But within the municipalities, that we all have the same message. And I think with Memorial Day weekend here, I think with similar to what your message said yesterday, we need to discourage people traveling into El Paso because we're seeing the effects of everything being so close to, or our communities that are so close to El Paso, Chaparral, Anthony, Sunland Park, Santa Teresa, that have, I think, significantly more cases than a little further north into the county. So I think from that aspect, whatever we can do to work together to make sure we're sending the same messages. I know, I think that'll be a huge help. The other thing that we're working on Tuesday, and I know this is where the conversation veered off a little bit, but on Tuesday on our agenda, we will be considering an ordinance within the county for a requirement or an ordinance to require face masks to be worn in public. Although it would allow for some exceptions in terms of medical reasons and such. So, but I know we're trying to push it in the county as well. And the reason for us to follow up with an ordinance was so that there was not just, we want to use it for education, but without the education, without the ordinance that has some sort of enforcement behind it, we felt like, or at least I feel like the education piece might not be as effective. So that's kind of what we're doing in the county and trying to work alongside with the municipalities and then trying to continue to push this use of masks throughout our residents and the public so that we can continue on with the phased opening of businesses that the governor's had. And I know we had a very a high count that added to yesterday, the 40 cases, but I know, we've had various reasons for that, but it's definitely a reminder that we can't that we need to keep our eye on the ball here.
Okay, thank you, Commissioner. Chief Gallagher, did you have another comment? Or forget to put the hand down. Okay, Councilor Vasquez, did you have anything you wanted to? Oh, I'm sorry, Chief. You there?
Yeah, I just forgot to put the hand down.
Oh, okay. Councilor Vasquez, please, thank you for letting me interrupt, and please go ahead and continue.
Not a problem. And thank you again, Commissioner Sanchez, for sharing your time with us. And I personally am supportive of your efforts in the county as they pertain to that resolution. I do have some additional comments and questions. I think one, is the Descartes lab data that we've been using to track cell phone pings and our stay-at-home index, or whatever it's called, the mobility index. I'm wondering if we can't now switch that to Sunland Park, or if Sunland Park currently has the capability, or somewhere around there, right? So we can actually get the data to see how many people or how much traffic is actually going from New Mexico to Texas, and perhaps as a way to measure that, right? So I've heard anecdotally a lot of people are going to El Paso because they want to return some semblance of return to normalcy, and they want to go to a store, and they want to go to a restaurant or whatever it is. But it would be really good to see the data on that. And so, to City Manager Maestas, I don't know if that's something we can get in contact with Javier Gonzalez to see if we can actually track, using those cell phone pings, how many folks from New Mexico are traveling into El Paso over the next 2 weeks, and how that is increasing. And then the second part, I have some questions for Mayor Perea. Considering that I think the majority of cases came out of the Stampede processing plant, the meatpacking plant, and just continue to be troubled by what seems to be the lack of attention to the Otero County Processing Center. There is some issues down south, but in terms of the Stampede, Mayor Perea, I know that they are still operating. I can't help but think that at least 57 of those of those 57 workers, that's going to multiply to those households, because I understand many of those workers who were tested were asymptomatic or who tested positive. So I think we can expect that number to double or triple, right, based on who those folks have been in contact with. But Mayor Perea, do you feel that the situation at Stampede is under control? Do you feel that more needs to be done? Do you feel it was handled correctly? And is there anything that we can do as a city to assist, with any type of messaging to the state to make sure that isn't another source for an outbreak? So I wanted to hear your thoughts on that, Mayor.
Of course, the increased cases, it is of concern to the city, because obviously they're going to go home, and the average home here has about 2.8 people living in it. So you're going to see some sort of spread there. What's alarming to me is that, we had, the last number I had from Stampede was five cases. From 5 to 57, that's a huge increase within one location. I'm not sure if that's because testing is not done on a frequent basis. I mean, I don't know exactly what the situation is within Stampede. And that's why I'm requesting increased testing within the city of Sunland Park and at different times. Because right now they're offering testing, the public health office is offering testing Mondays and Wednesdays from 7 a.m. to 9 a.m. Well, that in itself provides a gap of an entire population. Mm-hmm. If residents who work Monday through Friday, 8 to 5, are not going to risk waiting in line and getting linked to work to get this testing. And then it's not available outside of that. So I know I'm requesting the testing to be done, maybe one day 7 to 9 in the morning, fine. The next day, have it, 5 to 7 in the evening, so that we can get a different demographic, a different group of people who cannot make it during those times. So, I mean, like I mentioned, just because of our jurisdictions, it just makes it difficult to, I know we talked about, quarantine, I've thought about, if we declared martial law here, closed everything off, it still would be impossible because of just the nature where we are at. But, there's 15 different entrances from El Paso into the city of Sunland Park. I have communities here where half of the house is in Sunland Park and the other half is in Texas. So, I mean, to think that one size is going to fit this entire state or our particular community is I don't think is going to work here. So I'm pulling from all different sides.
So Mayor, would it be helpful? I think someone,
Councilor Vasquez is speaking.
Oh yes, this is Councilor Vasquez. I think Councilor Gandara had mentioned a delegation letter from Doña Ana County elected officials that would request a number of things from the state. Something I think we would be happy to sign on to if there was consensus on the council to support your request, right? Knowing that it impacts our community, our county as well. So maybe there's kind of a list of items that we can include in a delegation letter from Doña Ana County that requests resources, that includes the lab testing, that includes the additional testing capacity in Sunland Park. And I don't know what your thoughts are on this, but I think the Department of Health needs to go into Stampede and actually do an analysis or an evaluation of their practices, because like you said, going from 5 reported cases to 57 to me is a huge red flag that they clearly were not following whatever protocols were recommended. Otherwise you wouldn't have seen that giant spike. And if they were following the protocols, then those protocols need to be tightened up, because that's a huge exponential jump that really threatens the well-being of our community. So maybe the Department of Health needs to go in to Stampede and just do like a very thorough evaluation and inspection of their processes. That's in your jurisdiction, so I leave that to you. But just perhaps as an added measure of accountability, rather than letting the folks there kind of dictate how they're running things. And then on the last thing that I'll bring up, I know my colleagues have some comments and questions as well, is, I mentioned that that we have to face this new reality, as you mentioned, Mayor Perea, that people will be going to El Paso regardless of how many PSAs we put out and how much we encourage people to stay here for various reasons. Not to forget Memorial Day, and people have family on both sides, and they may want to get together for a barbecue or a cookout or whatever, and we can't stop them. And so realistically, to address that, how do we as a county and as a city and group of cities account for that increased movement between El Paso, Juarez, and New Mexico? And I'm not sure I have all the answers to that, but it seems to me that definitely increased testing in Sunland Park or some of those border cities that border El Paso and Mexico would be a solution, with maybe even those billboards, those digital billboards that are on the highway, perhaps pointing folks to like a number where they can get tested as they're driving in and out of El Paso. I know that's something that the state might be able to do that's specific to southern New Mexico or Las Cruces, right? Want to get tested, call, XXX or something like that. I think currently those billboards read something like the face mask is required or something in New Mexico. But how can we be more impactful with drivers as they're coming in and out of New Mexico and El Paso? So maybe this list of things that we can ask for on behalf of our municipalities and the county as a whole can include some of these things that helps us address the reality that folks are traveling, right? Maybe we do ask for that data as well from Descartes Lab in addition to that, because we do want to keep our community safe when the governor starts to open more businesses up on June 1st. I think I want to feel like we're doing everything we can to make sure that we're doing that safely. Seems to me like there's a list of things that maybe different municipalities in the county could ask for in a delegation letter like that. So, but thank you, Mayor Perea. It's good to see you. I know, as you mentioned, the intricacies of presiding over a border city in 2 different states and 2 different countries has a lot of challenges, but have seen your leadership really shine in the last couple of years. And so I know you're doing the best you can, and hope we can get that Stampede meet at least thoroughly inspected and under control as far as the infection rates there. Thank you, Mayor. Thank you.
Thank you, Councilor. Mayor Perea, I got a quick comment for you, a question. Is it fair to say that a lot of residents use La Clinica there in Sunland Park?
Yes, but then there's no hospital in Sunland Park. So for hospital services, a lot of people go to El Paso.
So I reached out to the gentleman who runs that lab here in Las Cruces, and remember earlier I said that Memorial or Mountain View uses them. I asked if La Clinica could use them. He said, absolutely. And so I will get you that information we can convey that to Virgil there at La Clinica. And then Commissioner Sanchez dropped off, and I was going to let him know, I presume if La Clinica can use it at Ben Archer, so anyone can, any of our medical facilities, not just the hospitals, but here in the county can use that. So we'll get that information to you as well, just to let you know, so that they can get those testing done really fast.
Perfect.
But they would probably have to go to La Clinica, have them do the test. La Clinica can take the here to Las Cruces. They can get it to them that, I'm sure, that same day or the next day. The results, that is.
Great. Thank
Okay,
you.
we have and if you wouldn't mind, these questions are really geared towards Mayor Perea and how we can help Anthony and Sunland Park. I mean, the discussion on the face coverings, like I said, I'll put that on the agenda at our next agenda meeting, which is next week, and then we can go vote on that how you see fit. So if you can keep your comments directed to Mayor Perea on how we can best help him, although he's taking options and ideas right now. So.
Mayor, I guess I don't want to commandeer the conversation here, but I believe Mayor Trujillo is on the
oh, good.
on
Mayor
here as well. So just.
Oh yes, I see it, Mayor Trujillo. Thank you, Mayor of Anthony, New Mexico. Thank you for joining us. We're here with the rest of my colleagues and various senior city staff, and we're discussing ways to best help both Sunland Park and Anthony. So I'm gonna, if I could ask Councilor Sorg, or you had a quick question you wanted to ask Councilor Sorg, and then if I could interrupt you and let Mayor Trujillo say a few things.
No, Mr. Mayor, go ahead and let Mayor Trujillo go ahead. And
okay, thank you. Mayor Trujillo, are you there? Hello? Okay, we're having some little difficulties there. So maybe we'll get her to here just a little bit. So Councilor Sorg, go ahead.
Well, yeah, thank you. This is Councilor Gil Sorg. I just wanted to, most of what I was going to ask about and talk about is Councilor Vasquez has already mentioned the whole situation down there in Sunland Park. And more, the most important thing I was wanting to know if Mayor Perea, if he thinks that, oh, by the way, Mayor, it's a good first time I've seen you since we were in Washington, D.C. together. It's good to see you again. You look good. And if you think the Department of Health is doing enough there to help you in your effort against the COVID-19. But you've answered that question for the most part now already, unless there's something you want to add. I just wanted to make a comment. The obvious comment here is that what happens along the Texas border from Chaparral down to Sunland Park and everything in between is affecting the whole county all the way up to Hatch. And so this is important that we all get together here and work together to get it under control as best we can under the, as was mentioned, the unusual situation that we have with 3 states and 2 countries. Okay, Mr. Mayor, the other comments I have would be best taken care of when we get to the next item on the agenda. Thank you.
Thank you, Councilor Sorg. Mayor Trujillo, are you there?
Can you hear me now?
Yes, we can hear you now.
Okay, sorry. I'm sorry. I've been at the meeting since what, 9:00 something, and I've been jotting down every notes that you guys have spoken about. And I thank you for inviting me on this, because it's very important. The city of Anthony is partnering up with City of Las Cruces and City of Sunland Park, being that we're so close to the state line, right? I know Mayor Perea has it more, a little bit more complex because it has Mexico plus El Paso and then New Mexico. But with us, it's here with Texas. And the reason I'm kind of concerned with Anthony is because Anthony, Texas, we're a mile away, right? So a lot of our residents get the resources from Anthony, Texas. The groceries, we don't have that here. And we've had problems where there in some of the businesses, they're not wearing their masks, right? Or the social distancing, but yet they come over here and we've had a spike on our cases that had tested positive. And also, I don't know, Mayor Ken, yesterday, if you heard that our Department of Health hasn't been assisting us the way it's supposed to with the time frame of hours, being that it says on the ad that it's supposed to be from 8:30 to 11:30. And I guess the time limit until 11 will be the last person that can sign up. And then when it comes to it, I've had lots of residents complain that they just give them like an hour from 9 to 10:30 or 9 to 9:30, and they say we're done. And so they end up going to Las Cruces. Well, I believe in Las Cruces, you have to have an appointment, and it's just been going back and forth. So we're having that problem here in Anthony with the testing. And this morning I got a information from County Manager Macias. He sent us some masks here to Anthony to help us alleviate with, offering the mask to individuals here. And our law enforcement, our Chief Ordóñez has been doing the soft enforcement, where letting people know that they need to wear the mask or dissolve any gatherings. So we're trying to approach it that way instead of being very confrontational, so our residents can understand that this is very important for them to wear the mask and have that social distancing. And I think because down here, I've noticed that we're very family, tight knit. It's everybody wants to social gather, oh, it's okay, we're okay, and people aren't taking it serious. So I think hopefully we can move forward. And with this Memorial Day weekend, I'm kind of concerned, I'm afraid, but and we can't force people, right, not to go to El Paso. And a lot of people in El Paso, they gather, or I've seen it when we took a cruise just to see how is it going. In Las Cruces, there's totally different, right? Everybody's like, no, we can't be gathering, or the businesses are a little bit more different. So hopefully we can get something going for that. Thank you.
Thank you, Mayor Trujillo. I appreciate it. Mayor Megashima had to step out. The governor is calling him. And so, Councilor Flores, you're up.
Thank you very much, Mayor Pro Tem Gandara, and thank you, Mayor Perea and Mayor Trujillo for sitting in on this meeting. And I also want to thank Manny, who had to leave, Commissioner Sanchez. I want to thank Mayor Pro Tem Gandara and Councilor Bencomo, who first brought this up about a meeting or two ago. We've been meeting regularly on Fridays, these special meetings specifically focusing on COVID issues. And and the Department of Health, we've had 2 meetings with them. And one of our counselors, Tessa Stuvey, Councilor Abeta Stuvey, a point blank just asked the department for, this was about a month ago, brought up the concerns about testing and how we need labs and how we do have facilities. We have an MSU, yada, yada, blah, blah. When we met with them, was it last Friday? I think it was last Friday. They still hadn't done anything. And they still said they were looking at this, and they were, and so frankly, and with all due respect to, the people that we met with, but the department as a department just hasn't been functioning, and it hasn't been helping our communities, and it hasn't come through on the requests that we've made. And it came down to, I think it was Councilor Sword or Councilor Vasquez and the mayor had been contacted by someone who is here in Las Cruces who was able to provide that service. In fact, that person's name, I think, in that facility came up when we spoke with DOH, and they still hadn't done anything. And I have followed up with our city manager to see if he's received any updates in that regard. And so far, there's nothing. So for them to then come down and insinuate whether it's a representative or whether it's directly from the governor's mouth, but it came certainly with some authority to say at yesterday's meeting that they're considering a shutdown of Doña Ana County because they're not happy with our numbers. Well, we're lucky that a lot of us haven't died yet. I mean, it's a terrible thing to say, but it's very aggravating to me that they're shutting us down and yet they're doing nothing to help us. So, and then I think that all of us as a community, and I think it falls very heavily on Mayors Trujillo and Perea, who are in that tri-state or whatever duo state situation, and then that Pilon, Ciudad Juarez, throw that in. And it's just so complicated. And it just seems to me that the DOH and the powers that be with the powers that be, whoever they may be, because God knows who they are, because nobody's acting, so we don't know who really has the last word and what gets done. So I'm very, very happy that, and I agree that it's testing. And the fact that Stampede went from 5 to 57, as I'm already calling Vasquez governor, as Gabe Vasquez said, this is an exponential, and we're going to see more of that because the state is doing nothing. And here we are as municipalities trying to do things. And I know that I've had many, many emails from constituents, and I forward them to the chief about the big box stores, and I'm going to call it. It was the Walmart on Rinconada, where the employees didn't have the masks, and they did have a huge sign in front of Walmart, according to my constituent, a big sign saying that they're required to wear masks, but in fact, as our city attorney alerted us a few minutes ago, no. They're private businesses, so they're not really, quote, public spaces, unquote. And before, we don't want to take something like that to the U.S. Supreme Court because, time's a wasting here. Lives are being threatened. So I just want to be emphatically in support of the efforts that started yesterday. And I think it will take a delegation letter showing and I'm sorry that Hatch isn't represented here, and it would have been good to have Mayor present here too, but to have all of the municipalities and townships present, and I hope they're all signatories to that letter to the governor or to the whoever it's going to be addressed to, with CC to the DOH. And I want to thank everybody for all of your efforts, and I'm very happy to be a part of this team. Thank you all.
Thank you, Councilor Flores. Councilor Stuvi.
Thank you, Mayor Pro Tem. Thank you, Mayor Perea and Mayor Trujillo, for joining us today, and for County Commissioner Sanchez. I've been very curious to see how things are going with you. As was mentioned earlier, I've been a strong advocate for the test processing here in the southern region to kind of help with our community and for those mitigating measures so we can keep our numbers down. One of the things that I'm curious about now that you guys are starting to see spikes, are you finding that, and you may have touched briefly on this, that your communities are needing those resources, especially once they're quarantined, such as food, how they're getting their medicine? If you're seeing any gaps that we need to be kind of anticipating and thinking about.
Over here in the city, we do have a nonprofit that we're working with, the Southern New Mexico Project, who has also been working with Casa de Peregrinos, which you guys are familiar with. So getting access to food, I think we've been doing okay so far. We've had just about a food pantry every week over the last several weeks. I would have to do a little more research on, access to medical supplies and things like that with the constituency. I actually have a meeting with business leaders later today, and those are going to be one of the topics I'll be covering with them to see if they have access to face masks and things like that. That maybe we can help provide or create a channel of supplies for them. So that we're in conversations with some of those issues that you brought up.
Thank you.
With the city of Anthony, I know Casa de Peregrinos is also assisting us with distribution of resources. Also with the medical supplies, like I stated, we did reach out to the county manager to be able to get us with some masks for this, and that's all we've been doing right so far right now, and we're doing more research to see what else we can do. I also spoke with Victor Reyes, the assistant for the governor, and he was going to try to draft me a plan in order for, to get more assistance for Anthony residents to be able to get some of the resources, because I did state to him that we don't have, like Mayor Perea said, we don't have the testing in the evening for some of the residents that are essential and that they go to work 8 to 5. They can't make it on time for the testing, because the testing here in Anthony starts at 8:30. A lot of these individuals go to work at 8. A lot of them go to El Paso, so they have to leave at 7:15 to get to work. There's no way they can get tested. And then when they get home, nothing's open for them to have the testing. So that's the problem with us. And then plus, like I stated before, the testing from 8:30 to 11:30 is not happening the way they said it was going to happen. And so we have a lot of residents that call to Chaparral, nobody answers in Chaparral. The health department over there, Las Cruces, they've gone to Cruces, or if they've called and they say you have to make the appointment. Sunland Park, I think they've had some that they have fortunately been able to be tested, but I mean, a lot of them don't have transportation here in Anthony. And what do? I mean, it's just very difficult for us here in Anthony with all this. So hopefully, Mr. Reyes can help us with a plan to see how we can be able to resolve this here in Anthony. And if anybody has a template that we can mirror from for the ordinance for them, I know because everything's different. Las Cruces is such a bigger city, and how we can be able to coordinate to make for the city of Anthony on the mask. I mean, we have to have an ordinance, something here in Anthony, because people need to, in a soft way, not confrontational, right, but be able to let them know you have to wear the mask for your own safety and the safety of others, for those that are weak immune system and the ones that are just the elderly. I mean, simple as that. Thank you.
Thank you, Mayor. A second question that I was going to ask was, since you guys are so connected with the border, and once you start seeing cases, you talked about a lot of your constituents are receiving care in the El Paso side. Are you guys, are you in the plans of El Paso for their medical plans and capacity? Were you guys included in those plans?
I'm not sure we were included in those plans at this point. I did have a conversation with the university, Center for the Americas, the Medical Center for the Americas in El Paso a couple weeks ago. And actually, I think they were a little more concerned about reaching capacity before New Mexico. And I think they were more complimentary about how New Mexico is handling the response as opposed to Texas. Because they even brought up the attention, or brought to my attention that they anticipate there's about 100,000 Americans who are living in the state of Chihuahua, and their concern is that it is severely underreported, and if it gets worse in Chihuahua, that those individuals may travel up to El Paso to get medical treatment. So I think they were looking at, okay, well, what resources exist in New Mexico that maybe we can capitalize on as well. Because yes, if capacity is reached over here in El Paso, the next nearest city or large city is going to be the city of Las Cruces. From there, San Antonio is 8 hours away. So it's I think they've analyzed what we have, and I think they're looking at New Mexico for an alternative at this point, I think. Which I think, I'm sorry to interrupt there. Which I think is different in the southeastern part of the state, where the mayors there have indicated that they're counting on Texas medical resources in Lubbock for if they reach capacity in that area. Mm-hmm. So.
Absolutely. So that's something that we might want to consider, especially if we see those cases rise in El Paso, is asking for that medical corps to be stationed probably, right in your, along the side of the border. And I say that because we know that a lot of these cases are becoming very emergent right away, when you have respiratory problems. And even the drive from Sunland Park or Anthony up to Las Cruces could be wasting that valuable necessary time. So I strongly would urge everybody to look at that to see what types of resources we could start looking at and placing them right in your neighborhoods and your cities, because I think the drive time between your community and Las Cruces could be very problematic, especially in those emergent cases. So going to echo the sentiments of a lot of my counselors saying that we just need to be increasing that testing and capacity. But I want to make sure that we're helping out as much as possible, because it is all connected. And like you said, as we see these cases increase, everything's just going to start filtering up. And it's already in your neighborhood. It's going to be in ours. And as people get sicker, we want to make sure that we're being able to handle their needs, not just with masks, but also medication. I'm sure nebulizers are being used. So are those in stock? What side of resources might your communities need that perhaps the state needs to be thinking about and bringing to your area? So thank you, mayors, and thank you, Mayor Pro Tem.
Thank you, Sir Abeyta-Stube. Commissioner Sanchez, I understand you have your hand up.
Yes, thank you, Mayor Pro Tem. This is Commissioner Sanchez. I just wanted to add to what was, I think, something you had mentioned earlier, or at least, and also I think this is a common theme, is that while the governor is looking obviously at the entire state, and yes, she singled out the northwest part of the state, we need to be making sure we're standing up together and working together to communicate exactly what it is our county, our municipalities need. I know Mayor Trujillo, Mayor Perea have both said the same thing, and I know this is, and this came up as well. I think Mayor Pro Tem, you said this yesterday in terms of the timing of the testing, and that we need to be able to have times that work for those that work during the day. I know the Department of Health has just recently started to work or get agreements with La Clinica, so hopefully that will provide some additional testing sites. I've also seen where they have finally started to go outside of the Department of Health facilities. They did testing at St. Anthony's there in Anthony, in Garfield. We had a testing site as well. So we are, like I said, I think there's some progress there, but I believe we need to be very clear to how we communicate what it is we need here in Doña Ana County, and then within our municipalities, because that's the way that I think we will get a better response that way, rather than the waiting for the governor to specifically look at us and ask us what we need. And I think that where she's looking at the entire state and doing these relaxation of restrictions throughout the state, we just need to know what we're doing, communicate what we need here. And I think these conversations that we're having are absolutely important, so that, we can, whether it be a letter, whether it's dialogue via phone, we make that clear up to the governor's office and the Secretary of Health as well. So I just wanted to add that, and I appreciate the conversation y'all are having here.
Thank you, Commissioner Sanchez. Councilor Bencomo.
Thank you, Mayor Pro Tem. For the record, this is Councilor Bencomo. I really appreciated this conversation, and I think Councilor Vasquez wrapped up a couple things really well. I think for me, it's important to figure out some next steps and just get clarity on that. I'm wondering if City Manager Maestas is on, if perhaps you can take the lead on this letter, or who will take the lead on this letter coming from the delegation, and how quickly we can all sign on to it and get that turned around and sent up to the state. I think I do believe that folks like Victor Reyes, who is from down here, right, and the governor have an interest in helping us. I think what we can do is just be exactly clear about what we need. And honestly, Mayor Perea, you said fine 7 to 9 or whatever, maybe 5 to 7. I think we need to ask for more. I think we need to ask for more days for testing, longer days for testing. I think Mayor Trujillo just said it, right? Like, the information is super unclear. Some offices aren't even answering to schedule appointments. Like, we just need to make those things very clear in a letter. These are the barriers that our residents are experiencing. I brought up the issue last Friday about some testing centers asking for social security numbers. Like, that needs to stop immediately. I just think we need to get really clear about the things we're asking in this letter, and ask for them, yesterday. So I'm wondering if we can also provide, or if perhaps you already have, Mayor Perea and Mayor Trujillo, provided, and Manny, Commissioner Sanchez, if you've already provided locations and times that you'd like to see, definitely will take your lead on that. I just want us to not have this conversation and then sort of it not go anywhere. So I don't know who can answer that question for me, but about who's going to take the lead on this, on drafting up this letter that we can send up to the governor, and then just get some clarity on the things we need. So I'll stop there before I go to my next point.
Councillor Bencomo, before I go to Mr. Maestas, I know that Commissioner Sanchez yesterday on the call said he would take the lead of putting something together and then sending it to the mayors and folks to see if that is conducive to what we were talking about. And so that's a piece of it. And then I'll let Mr. Maestas, I noticed he put his hand down, but Mr. Maestas, do you want to say anything here?
Yes, thank you, Mayor Pro Tem. I went ahead and took my hand down because you answered the question for Councilor Bencomo succinctly, so there was really nothing for me to add. So thank you very much. I appreciate that. This was David Maestas for the record. Thank you.
Okay. Anything else, Johanna?
Great. Yes, thank you. Yes, this is Councilor Bencomo again. I don't know, Mayor Perea, I saw you turn your mute off. Did you want to jump in here and say something, or?
I just wanted to add one more thing, and that's through the updated executive order on our end here at the city. I did submit that, for us to request additional testing within the city of Sunland Park. And I'm trying to work it through the political side as well, and then through the administrative side as well with staff and our public safety coordinator. And I believe we're going to get another full day of testing until I guess we're done with tests. But we have several locations on here within the city that we made available for testing. So that should be hopefully coming in on June 11th. But I mean, that's some time between now and then, and it's. I mean, I can get a lot more cases between now and then. So I know things take time, and we're trying to work every avenue that we can. But there's I guess some movement coming from the state.
I hear you. Yeah, for sure. I mean, I agree with you, right? And as a new elected official, trust me, I'm beginning to understand how slow things move sometimes. But I just feel like this situation is just so different, right? Like, we need those tests now, immediately. We can't wait till June 11th. And, I'm trying not to feel discouraged by this surge we're seeing. I think we all sort of knew it was coming. And, as we approach Memorial Day weekend, and as we approach June 1st and the easing of some restrictions, and right, like, we have to get back to some degree of normality eventually. But as we begin to do that, what is our plan, right? And I think for Doña Ana County, I'm so glad we're having this conversation for not only just a unified message, but a unified testing plan, right? Like, I think these are the things that need to be in the letter. What is our plan for testing? Will we have enough tests? Like, who can tell us that right now? Test availability. Do we have people power to perform the test? Are we going to have quick turnarounds on test results? Are we going to hire our own team of contract tracers in Doña Ana County to help identify, to help isolate whoever needs to, right? To sort of prevent a resurgence, even though we might continue to see cases here and there. I just feel like those are the things that we need to ask clearly, and then quickly, and then, you know, sort of say, like, I can't wait till June 11th for more testing. Like, that's just no, right? And so, you know, as much as I think we just need to work together, but we just have to be really clear about the things that we're asking. Thank you, Mayor Pro Tem.
I see Mayor Mehigashima is back on. Councilor Flores is next. Mayor Mehigashima, thank you.
Did you give me the floor, Mayor Pro Tem?
I did.
Well, thank you very much. And my apologies. I thought I was on mute earlier, but so I'm sorry. I was probably blowing my nose and talking to my dog. But yeah, you know, that June 11 date is just too far away from me. But as far as the letter or where it would come from, I don't know what the delegation has said, but it seems to me that it would be, you know, it would be appropriate for all of the municipalities. What I would propose is a letterhead with all of the logos of all of the cities. You know, like we have our little sun with the 3 crosses, and you know, all the whatever the county commission logo is, and just put it up on top. You know, at the top of the letterhead. And then the signature lines would be all the mayors or the respective parties to the delegation. But I think it would show strength, and I think that I think that's how it would be best to have the delegation have its own letterhead. It'd be something that probably wouldn't be difficult to put together quickly. But that letter has to go out really, really soon. And I think that the sooner it goes out with everything that's been discussed, that was discussed yesterday at your meeting, everything that's been discussed today, I think that all that information can be put in there to the point succinctly, and then get the signatures and get it out as fast as possible. The testing just can't wait. The test results can't wait. The contact tracing can't wait. It's just gone on too long. And heaven forbid we do have a shutdown. That would be definitely adding insult to injury. And it wouldn't resolve the issues that we have in Sunland Park. It wouldn't resolve the issues we have in Anthony and all the, you know, cross-border of states and international lines. So that's my recommendation. I think that, you know, I've worked with organizations that we've done that, and I've never worked with another municipality or another governmental entity like that, but definitely with other organizations, 501c3s and whatnot. So I think it can be done, and it's a matter of, I think it's just a question of what you all want to do as a delegation, but that would be that's my input, my suggestion. Thank you.
Mayor, you're on mute.
Thank you, Mayor Pro Tem Cassandra Gandara, and thank you, Mr. Mayor. Thank you for coming back.
Myself. Oh, there he goes. Okay. So thank you, Councilor Flores. Governor and I talked about a lot of stuff and a lot of good things that I'm going to try to do. But one thing that she assured me is the only way to shut down Las Cruces or Doña Ana County, it would have to be, I would have to request that, which I'm not. So I just thought I'd let you know that, okay? Looks like Mayor Pro Tem Gondeta is next.
Thank you, Mayor. Mayor Perea and Mayor Trujillo, I wonder if, hearing what I've heard about the, the migration patterns from Texas, from, your areas to Texas and back, and folks that are living in El Paso, working in your areas. And one of the other places that I haven't really heard, and maybe Commissioner Sanchez could speak to it, is Chaparral. I'm wondering if pop-ups like for groceries and medical supplies.
Mayor Pro Tem, for some reason you're not coming across too clear. Is there something that's causing some static there?
Oh, I don't know. Can you hear me better?
Now we can.
Now?
Yeah.
Okay. I'm wondering if we can consider coordinating with local stores or continuing, because I know Casa de Peregrinos is providing food and the food pantry set up there, but pop-ups that would be providing groceries, medical supplies, things of that nature to encourage people to stay rather than go and get their I think many of them shop right in El Paso. That's just what they do, especially around the Chaparral area. And so that would be sort of my suggestion. And then I'm wondering if we have, I think, identified some local hotels for quarantine. And I wonder if that's something that we might consider doing there, if that hasn't been talked about yet. I'm just throwing out ideas. I don't mean any disrespect. We're all worried about each other, and I just want to make sure that I'm just throwing things out there in hopes that's some things that could benefit the area.
Mayor Pro Tem, I heard just briefly about hotels for quarantine. What area were you talking about?
Well, the area down south, Mayor,
Down south, okay.
Anthony, Santa Teresa, the Chaparral. Now, realizing that it would have to be, well, I know there's a hotel in between those areas, right?
They're all in Anthony, Texas.
Right.
But
it is our reality, right? It's our reality. So how are we going to work towards working with Texas mayor, maybe the mayor there in El Paso, to help us?
Yeah, that's one
May I jump in here real quick to comment on that?
Yes, Councilor Bencomo.
Thank you. This is Councilor Bencomo. I did know that Doña County has a couple sort of, what are they calling them, non-congregate shelter locations. Perhaps if we wanted to prepare, if we wanted to look for more and then include that in the letter, that we have facilities that can become non-congregate locations. I think that's an ask that we can certainly make. Mr. Mayor, you missed part of that conversation, but I think since you're obviously, you're not going to ask for a shutdown, which obviously we understand why not. There are things that you can ask for and that we all can ask for to better prepare. And perhaps that could be one of those things, more non-congregate facilities.
Well, no, what I was thinking is if need be, and we'll have to have Jennifer chime in, but we set aside certain monies to some of the nonprofits for self-isolation if needed, for various people. And I don't think there would be a problem even if it crossed a state line there in Anthony, Texas. I don't know. I don't know if Jennifer wants to jump in on that or not. I don't know if it matters that it has to be in, all in New Mexico. I think it can probably be in Anthony, Texas. Jennifer?
Mayor and Council, if we're talking about government to government, it shouldn't be a problem. Even with a nonprofit, it shouldn't be a problem. It's something that we can work around.
Okay. Good. Thank you.
Mr. Mayor?
Yes, Council, Mayor Perea.
Just to respond to the hotels, there is one hotel within the city of Sunland Park.
Oh, that's right.
So we have one.
Yeah, that's the Holiday Inn right there near the casino or the racetrack.
Yes, and we've had that conversation with them, but I believe there's maybe some minor things that would have to be done to the hotel to be retrofitted as a hospital or as a quarantine space. But they do have separate ventilation. All the rooms have separate ventilation systems, which I think is one of the requirements. Some of their concerns were also about, well, if we were to use it as a hospital, will they have to take out all of the right now the few guests that they do have? So we would have to take pretty much, would we have to take the entire building, or can we just take floors, or what's the scenario? Of course, their concern is the safety of their particular, their guests and their employees. So it is a conversation we've reached, but there's a lot of details, I guess, that still have to be sorted out. Talking about, I guess, the mobile pantries or the mobile food centers. I think in our situation, it's unless you can meet the pricing of the big box stores in our area, they're not going to be very successful. Because Walmart, we have a Walmart neighborhood market just across the state line. It's I mean, you can't tell the difference whether it's in Sunland Park or it's in Texas. So for some people, it's going to be easier to go to Walmart, and then we have another Vista store, which is, I guess, a local company here also. But that's, again, right across the state line. So it's I think it wouldn't be as effective here. In the city of Sunland Park, and we also do have a farmers market on Saturdays at Ardovinos Desert Crossing. So those are the resources that exist here. But for example, in the community of Chaparral, and I'll defer to Commissioner Sanchez on that, it might work over there a little bit better because there is some distance between Chaparral and retail centers in that area. Sunland Park is, we are at the border. We are right there next to everything. So, thank you, Mr. Mayor.
Thank you, Mayor Perea. I appreciate it. I totally understand, and I don't want to ever come across like you haven't thought of these issues or suggestions any. I know you haven't been working really hard. Again, I think this is more about, we have some resources that we can share. We're happy to do it. We just need to know what and how to move forward on it. So thank you.
Okay, looks like, Amy Johnson-Basford, you have something you'd like to say?
Good morning, Mayor. Amy Johnson-Basford, Grants Administrator. I was just checking who else was on the line, and I'd like to make sure that all of you are aware of the work that the Incident Command Group is doing, that they do have hotels that are available for quarantine. And those are being coordinated through the county health services department. And there are other supplies that are available through that command unit. So I would encourage the other communities to reach out to the OEM and see what they are still lacking that they might that the OEM might be able to provide to them. And then if they feel they need a hotel in the southern part of the county, that possibly the county health services can work with the state to designate a hotel there that could be used for quarantine. I just wanted to give that quick update.
Thank you. Councilor Flores, did you have anything else? It looks like you have your hand up. Councilor Flores.
Yeah, I had my hand up, but I think that all this stuff has been covered. I think it's very important to shut up right now. I can't. Thank you, Mr. Mayor.
Okay, I'm going to record that comment there and play it back from time to time. Okay, so Mayor Perea, Commissioner Sanchez, Mayor Trujillo, is there anything else you'd like to ask us or add to the conversation?
Mr. Mayor?
Yes, is that Mayor Perea?
Yes, sir. I just want to say thank you to all for taking a moment or some time to listen to our issues over here at the City of Sunland Park, and for being a partner through all of this. I think it is important as we move forward, to show the rest of the state, the rest of the world that we have to work together through this in order to get beyond the status that we're in right now. But I thank you very much for your time and your efforts during all this during this pandemic. Thank you.
Thank you, Mayor Perea. We appreciate you and all the efforts you're doing in your community. Okay, there's nothing further. We'll go ahead and move on to the next item, which is resolution number 20-161. I need a motion and a second, please.
So moved.
I second. Councilor Bencomo.
Okay, motion made by Councilor Flores and second by Councilor Bencomo. Okay, and I believe Dr. Francisco Paredes will be making the presentation.
Hello, Mr. Mayor. Hello, members of City Council. This is Francisco Paredes with Economic Development. Let me start sharing my screen. Can you see my presentation?
Yes.
Excellent. So the resolution that we have for you, Mr. Mayor, is a resolution to establish the Las Cruces Economic Recovery Ad Hoc Board. And today is May 22nd on the special session meeting. The first thing is that the purpose of the Las Cruces Economic Recovery Board, this was in response to what the state created in terms of New Mexico Economic Recovery Council. And this is to make specific recommendations to the mayor and city council on strategies for gradually reopening Las Cruces economy affected by the COVID-19 pandemic in a smart, safe, and effective manner that fits the needs of Las Cruces in alignment with the direction of the New Mexico Economic Recovery Council. And it shall be dissolved upon the full reopening of the economy in Las Cruces, New Mexico. This discussion was brought about by the City Council in itself in a special meeting on May the 8th, in which it was an intention to create this specific ad hoc recovery board for dealing with the Las Cruces economy as it is opening. The proposed members during that discussion, as they were proposed, number one, if I can recall properly, was Councilor Bencomo, who suggested having members from the union, from the United Food and Commercial Workers Union. There was also a suggestion to have a member from a local nonprofit organization. There was also another suggestion to have a member from the healthcare sector, and specifically was named about a nurse, and Mayor Pro Tem can probably speak a little bit more in terms of that. But this was on the May 8th session. And then a member from the workforce solution, one more member from the mental behavioral health sector. Then it was a suggestion to provide 7 business owners, one each from one of the councilors' districts, and then one more from Business Recovery Committee convened by the Las Cruces Greater Chamber of Commerce. And this was proposed by you, Mr. Mayor. Now, the membership process, it is, first of all, the first thing that we have to mention is that since it's an ad hoc board, it is exempt from the membership qualifications in Section 2-188, especially letter A, which implies city residency. So they do not necessarily have to be city residents. The applications will be accepted, and a link has been established to do this online. And once upon the creation of this board is approved with this resolution, we'll be able to start going with those applications. Special thanks to Christine Rivera, who helped us with this. And staff may facilitate for this. And appointments will be made by the mayor in an open meeting with advice and consent of City Council. And the next one is your standard options for City Council. And with that, I stand for any questions.
Okay, well, thank you, Dr. Paredes. Amy, did you have something you wanted to start off with, or did you forget to put your hand down?
I forgot to put my hand down, Mayor. Apologize.
Oh, no problem, no problem. No questions from my colleagues? Okay, Mayor Pro Tem. Yeah, it wouldn't be the same if we didn't get any questions from you guys. Mayor Pro Tem and then Councilor Abeyta-Stube.
I just want council and you, Mayor, to know that this was run by, presented at the Economic Policy Review Committee. We did make some additional suggestions. One being that I think that as Councilor Flores indicated, timing is everything. We have to, all of us have been a part of speaking to and selecting representatives for different boards, and it takes a while, right? Sometimes 30, 60 days, and we want this committee to get up and running like yesterday. And so Barbara De Leon recommended and agreed that staff could help with that application process. So if someone called and said, hey, you're interested, then they would be processed very quickly. As you know, I'm assuming the application process is very similar to the other committees that we have through the city. So it's not a lengthy process, but I didn't want there to be any barriers and any more time elapse. We need to get this up and running quickly. I also suggested that in our 7 people, the seven members from each of our respective districts, that we have some dialogue to ensure that we are inclusive of all those sectors like the nail and salons, massage parlors, maybe barbers, restaurants, but all the sectors that encompass our small businesses and our larger businesses. I think that's important. So I think that I've covered everything. Oh, as far as the nurse, I know Councilor Sorg had some concerns about the nurse piece, and what I had indicated is it is important to have someone from the health sector, but what I thought of specifically is the nurse at who's an epidemiologist. Her specialty is epidemiology. Someone I think that is important to help guide the group using science and evidence-based, and what from their perspective, as people are talking about slowly opening up, why they're suggesting the things that they are, always being reminded of the reality that our medical providers are facing. So with that, Mayor, I'll turn it back to you.
Okay, thank you, Mayor Pro Tem. We have Councilor Abeyta-Stube who wants to comment.
Thank you, Mayor. Mayor Pro Tem Gondra, were you thinking specifically of a person for that role, for the to go under the category of that nurse epidemiologist then?
I didn't have, excuse me, Mayor.
Mm-hmm, sure.
Mayor Pro Tem Cassandra Gandara. Councilor Abeyta-Stube, I didn't have anybody specific, but I know that Councilor Sorg had, a bit of a concern about who, a nurse, maybe it needs to be a doctor. And I know that, through my resilience leaders and trying to get medical providers to participate in a group during the day is very difficult, especially now during this time. And so I just want to remind us that we need to have as much flexibility. This might mean evening meetings, right, to ensure, or early morning meetings or lunch hour, to ensure that we're getting, the participation that we need. So I threw out that nurse from Memorial, but I know she's inundated and so busy. I just think it's important to have someone that has the perspective. And maybe it's Dr. Landon or someone that they from the Department of Health. There also is a nurse there that is specific to her practice is epidemiology, and they may want to participate in that.
Thank you, Mayor Pro Tem. This is Councilor Tessa Abeyta-Stube for the record. I was going to ask that because I was worried about limiting actually the application process by just saying nurse, but I think it's important to include a healthcare provider that's kind of, I want to say like maybe actual practicing kind of more of a bedside. So whether that's a doctor, nurse, but epidemiologist would be exactly right too, that sort of thing, but using that science and evidence-based. So if we need to take out that wording that specifically says nurse out of it so that we can include more applicants for that process that do kind of fill under that line, that might be something to consider. And then personally, I did have a constituent reach out to me. They are also a business owner in my district, and they are going to be, we had a very great conversation. They own a salon, and the knowledge that they have is very, very good for their industry. And it is somebody that I have highly encouraged to apply for this. And I think they'd be a valuable asset to serve. And that's all for me. Thank you, Mayor.
Okay, thank you. Councilor Flores?
Thank you, Mr. Mayor, and thank you, Mayor Pro Tem Gandara, for your input, and thank you for your questions, Councilor Abey-Testuvi. So at the Economic Development PRC, we discussed precisely what Mayor Pro Tem brought up. And as far as what Councilor Abey-Testuvi has brought up is good. I think that what I would recommend at this point would be that we can maybe amend this resolution today. I think that we'd be within our parameters to do so at this meeting, to expedite this to move along so that we can possibly be having a meeting a week from today where appointments would be made or applications would have been reviewed by then. So I'm happy to hear, Councilor Abey-Testuvi, that you've already spoken with one of your constituents in your district who looks like that person will be applying. So later, perhaps Ms. Rivera can tell us exactly about the process, what we learned from our director, economic department director, Dr. Martinez, is that there, or was it Dr. Payares, one of those two, indicated that Ms. Rivera already has links set up. Just a question of putting in the information and making those links known to the community so they could go out immediately following this meeting should this resolution be approved. Instead, I agree entirely with Mayor Pro Tem that it's very important to have the epidemiologist on board. And I also agree with your recommendation to have a doctor or a medical provider who's dealing with this, not provider, but the person or provider that you have suggested, so we can expand that perhaps. And in reviewing the candidates, it says there will be 7. It could possibly be expanded. And again, I'll defer to our city. I think it was our city manager at our meeting last week, or just a couple of days ago, Mr. Maestas, who said that it would be appropriate to make an amendment at this meeting, and then voting on it, an amendment to this resolution. And that would be to, I would suggest that we have an employee represented on this, because I think it's great that we have the United Food and Commercial Workers Union, the UFCWU. I think it's great we have a member from the Workforce Solutions, which is Bill McCamley's department, the State Department. But I think it'd be good to have someone who is actually an employee, someone who is a worker, someone who has been, really hit with this or affected by this. We all have, but in the economic sense. So anyway, I just wanted to report on that. I want to thank Dr. Payares and Dr. Martinez for moving this quickly and for this recommendation. So Ms. Rivera, could you educate us or edify us, or whatever the word is. Let us know what the process is from here insofar as your links are concerned. And then I have a question for our city attorney to see if we can go ahead with making those amendments to this resolution. Mr. Rivera, if you could address the process, the application process. Thank you.
Mayor, Councilor Flores, Christine Rivera, Acting City Clerk for the record. I did set up a link in our application portal online, which I sent to Francisco and Griselda the other day. I did tell them that they can input the information into there. I'll receive the applications and then submit them to the mayor for selection and approval at the next council meeting.
Thanks, Christine. Was that, did you have anything further, Councilor Flores?
Yes, Mr. Mayor. So, Christine, does that mean that we can, would we have time to put this, our next council meeting would be, could we do it? We have a work session on Tuesday, correct? Yeah, we have. Can we vote on anything at a work session, or would we have to wait until our next meeting, our regular council meeting?
Right. Mayor, Councilor Flores, the work session is just for discussion, so
right.
Be able to do the board appointments. The next meeting is on June 1st. I think that would be a good goal because that would give us enough time to receive the applications, seeing as we're just approving the resolution today.
Right. Yeah. So, okay, so I've got my bearings straight now. So we approve today, and then we have enough time to put it on our next regular council meeting. There's that 3-day, 72-hour notice requirement. So we're in full compliance in that regard. So great. Thank you. Thank you very much, Ms. Rivera. And Attorney Vega Brown, would you please clarify the process insofar as making an amendment and making this viable today?
Mayor and council, it's any normal process that you would amend anything. If there is a substantive change, of course, we would have to republish. It just depends on what your amendment is.
The amendment would be to add two more members to the board, and one would be to what Councilor Abeyta-Stuvey suggested, as to have someone, she would tell you what the language would be. And my recommendation, we have an employee from the city. Well, actually, you don't have to be from the city. You probably have to be working in the city, because we don't have that resident requirement on this ad hoc board.
Okay, that was Councilor Flores speaking, and the speaker before was Jennifer Vega Brown, City Attorney. Sorry about that.
Oh, and sorry, my apologies, Mr. Mayor. Yes, my question is from Yvonne Flores, Councilor Flores for Attorney Vega Brown.
Mayor and council, this is Jennifer Vega Brown. Sorry, Mayor, I continue to forget that. If the amendment is just to add the number of members, I don't see that being a problem. It's a simple amendment to make by motion. Regarding the addition of an employee, you have to remember that city employees are prohibited from being members of any board. They can be attend meetings, but they cannot be a part of any board. City employees.
Oh, well, I'm glad you made that clarification, because I wasn't intending it to be a city employee. It would be someone who maybe works at Oregon Mountain Outfitters, or works at the La Esquina or something, Rosie's or something. So that was the employee I had in mind, not a city employee. I mean, would it have to be specific and say excluding city personnel, or?
Mayor and council, this is Jennifer Vega Brown. I don't believe you need to be specific, because the prohibition of, regarding not allowing city employees is already in the ordinance, so it's already.
Okay. Oh, okay, great. Thank you, Attorney Vega Brown.
You're welcome.
And thank you, Mr. Mayor.
So thank you, Councilor Flores. Let's see here. I think Councilor Sorg and then Councilor Bencomo.
Thank you, Mr. Mayor. This is City Councilor Gil Sorg. It kind of goes back to, I want to go back to what we were discussing in the first part of our meeting, and that is the idea of masks and all the other things that we're doing to prevent the spread of the
Councilor Sorg, is what you're going to ask, is that pertaining to this ad hoc board?
Oh, yes, very much so.
Okay, okay.
And so my question is to you, Mr. Mayor, and perhaps maybe to Attorney Vega Brown. What can the city or any local government do or not do in the case of an order that the governor or the state of New Mexico comes down on? What are our possibilities? Can we make it more restrict or less restrict than the state does? Just what are our possibilities here? Can we change it at all?
I believe we can make it more restrictive than the state. We just can't make it more lenient. But I'll let Attorney Jennifer Vega Brown speak. But Councilor, if I may just say, you know, we're talking about the ad hoc board here, and I don't want to go back into that other discussion. We're done.
Well, isn't that what the ad hoc board is going to do, is make recommendations that, you know, for strategies, as it says there, and those strategies might be even more strict or less strict.
Yeah. Jennifer?
Mayor and Council, this is Jennifer Vega Brown. As the mayor stated, the city we can have policies in place that are more strict than the state, but as the mayor noted, we cannot be less strict.
Okay. Just wanted to make that clear. That's all. Thank you so much. Thank you.
Thank you, Councilor. Councilor Bencomo. And thank you, Jennifer.
Thanks, Mayor. This is Councilor Bencomo. I also just wanted to clarify that my suggestion for including the union was for it to be specifically someone who works, for example, at a grocery store, for it to be specifically a worker. And I think the best way to find that person is through a structure already set up like a union. So for me, that's what that suggestion was for, specifically.
Okay, Councilor, I think
if I may, Mr. Mayor.
Hold on one second, Councilor. I was just going to say to Councilman Como, I think that's a great idea, but just keep in mind, depends on their employer whether or not they're going to let them take that time off to attend a meeting. Now, whether or not they're going to pay them or not pay them. So it may be a little bit challenging. So just put that out there.
Mr. Mayor, I did want to emphasize that because unions are very, very particular about going anywhere with this. My son was a union organizer and a business agent, and my husband was a vice president of ILGWU. So my ex-husband. So I know my father was a Teamster and president. So unions are very, very interesting animal in that regard. So
your father know Jimmy Hoffa?
Yes, he did.
Okay.
Yes,
I'm curious.
And he knew Jimmy very well. His son. So, but all that being said, I don't know what's going to happen with the UFCWU. Do we still want to have union it's going to be probably a union representation. It's going to be their call. It doesn't necessarily mean it's going to be an employee. I doubt very much.
Exactly. That's what I was trying to get at. It may not be an employee, but it could be someone from the union, which, but
it should be good.
Okay.
So, but I think it's a great idea, Councilor Bencomo. I think we should keep that. And I think that we can add, and we can have, Thank you, Mr. Mayor.
Thank you. Thank you for jumping in front of Councilor Beta Stuvey. So, Councilor Beta Stuvey. Let me apologize on behalf of Councilor Flores for.
That's all right, Mayor. This is Councilor Beta Stuvey for the record. I was going to make a clarification as well. I think that all that needs to be done is to remove the requirement of just say nurse, because I think it's under healthcare professional. That way we're just not limiting ourselves to that one specific RN designation, but we have somebody from the industry. So I don't think it requires me an add-on, just the removal of the nurse requirement. Thank you.
Mr. Mayor, may I ask a question of?
Well, I think you're jumping in front of Mayor Pro Tem Gondara.
I know, but my question is for her anyway, so.
Okay.
Please. Thank you. Thank you, Mr. Mayor and Mayor Pro Tem. I think that what you're asking for is Mayor Pro Tem, a specific representation on that ad hoc board. And I think instead of not adding what another member of the health field, because there is the healthcare sector nurse specified in parentheses, and then the other is a member of the mental/behavioral health sector. So would you like to clarify the distinction between the two, Mayor Pro Tem, and whether we keep those two specific nomers of the makeup of the board, and should we add what Councilor Beta Stuvey has suggested? Thank you. And thank you, Mr. Mayor.
Thank you, and Mayor Pro Tem Gondara. Again, my apologies on behalf of Councilor Flores for jumping in front of you. So you got the floor.
Cassandra Gandara. The clarification, I mean, I don't know, I didn't write up the resolution, and I don't think I was included in adding the nurse, but I envisioned, as I said before, having someone that has the knowledge that would give this group, you know, as we all have learned, because some of us aren't in the healthcare industry, what this COVID does, why these necessary precautions are important to do if they want to do something that maybe is not in probably the most healthiest or safe thing. I think it's important. So I envision this group like we were having Michael Landon there to educate us on what is happening specifically to Doña Ana County, the cases, the rates, all those things. But then, and the difference between the healthcare provider and the mental health provider is that, well, they're different, right? Some of them are still seeing patients remotely, right? And some of them are actually providing home visits, going and addressing people's safety and well-being at their home. And so they're very, very different. And so and they also are looking at things through a different lens than the others are, right? They're looking at people's mental health, the barriers and gaps to providing those kinds of services. I'm not arguing one way or another. I mean, if you want to add an employee, I think that's fine too. That's probably very important. And I think Councilor Bencomo is intent was, so we have representation. So we get to hear from our local business community in all aspects, what they're encountering, what their barriers and gaps are, and then they're educating us so that we make sound policies for them, or with them, if you will, and then that they are a voice to Santa Fe, right, to our governor's office about what they're feeling, what they're seeing. And this can also be sort of the difficulties around PPP and that application process and how as a city we can help move through that process or in conjunction with. That's it, Mayor. Thank you.
Thank you, Mayor Pro Tem. Councilor Flores again.
Yes, thank you, Mr. Mayor, and thank you, Mayor Pro Tem. What I'm also focusing on in terms of the language of this resolution is that we have to have, and we don't have the language up yet insofar as the link, that portal, that the language hasn't been developed yet. And again, it'll probably be done by Dr. Pallares or Dr. Martinez or Christine, Ms. Rivera. But it's just when it's, say we were to post the resolution online or take that paragraph in the resolution that is looking at the composition of this ad hoc board, and someone sees nurse, well, member of the healthcare sector, parenthesis, nurse. I think it leaves it wide open. It doesn't really define what we need. So, I mean, I understood this in our meeting a few days ago to mean that it would be someone, as you described, like a Dr. Landon, that word is so hard for me to pronounce. But, and then we have the mental / behavioral health sector. So that one, that one is more definite. But when we have healthcare and then again, mental health, I'm just trying to make it fair for people who are going to be submitting their applications for them to know what exactly they're applying for. So we might have RNs applying, we might have, different nurses applying who aren't necessarily have that background as a Dr. Landon would have. And I just want it to be fair to the applicant, to be clear to the applicant, and to make sure that we're getting an ad hoc board that represents what we really feel is needed. So. Can you comment on that, Dr. Gandara, Mayor Pro Tem Gandara?
I really don't have any comment. I agree with you wholeheartedly. I'm assuming if you want to make an amendment, you're free to do that.
No, I wasn't asking about, thank you very much for your support. I just want to make sure that we are making the call to this application fair to the person who may be applying to be a representative. So does anybody have any input, any other counselor, any Dr. Pallares, Mr. Maestas, Gil Sorg? I'm looking at the list here. Gabe Vasquez, Councilor Bencomo. I mean, I guess I'm not making myself clear. Nobody cares. I don't know. I think it's very important for someone to know what it is they're going to be applying for. And I don't want to, I just don't want it to look like, oh, there's a nurse here, and then we get all sorts of, there's all sorts of, there's LVNs and everything like that. That's all. So I just want clarity.
Okay. Dr. Pallares, looks like Dr. Pallares would like to make a comment.
Mr. Mayor, Francisco Pallares with Economic Development Department. I just wanted to let you know, Councilor Flores, that it is your prerogative, city council's prerogative, if you want to strike out that portion of the nurse and make it more general or a healthcare sector, and that would probably address your concerns, and it would make it best so that any healthcare provider would be able to apply for being part of this board as an amendment, of course.
Thank you very much. I think that's an excellent idea. So I would like to amend the resolution at this time, if I may, Mr. Mayor. Or excuse me, I guess there's more discussion on this.
Let's see, Councilor Bencomo. Yeah, so let's ask the rest of the council before you make your amendment, if you don't mind. Councilor Bencomo?
Yeah, I'm super unclear about what's happening right now because I had heard already Councilor Abetas, do we make this recommendation for an amendment? So I'm unclear about what Councilor Flores is referring to, but I do support moving forward with what Councilor Abetas Dewey suggested and making this particular bullet point not just a nurse, but a healthcare professional.
Okay.
Which is what I understood was happening.
Okay, Councilor Abetas Dewey, did you want to comment on that? Oh, well, wait, David, you have a comment? Maestas?
Yes, Mayor, if I could, and maybe this will help with the confusion. This is David Maestas, Interim City Manager. Councilor Abetas Dewey did bring up the discussion as well as Councilor Flores, but we never had a formal amendment with a motion to bring the amendment forward. We need to, if there's going to be an amendment, one of the councilors has to make an amendment with a motion and a second to bring it forward, and then there can be discussion specific to that amendment for a vote on that, and then we can get back to the resolution topic after that. I hope that helps clarify for everybody. Thank you.
Thanks, David. So, Councilor Abetas Dewey, what was it that you were wanting to possibly amend? And then let me just compare that to what Councilor Flores was talking about.
Yes, what I would like to amend is just strike in parentheses. It had noted that the healthcare representative, it said nurse. I just wanted to strike the nurse portion so that it just said the healthcare representative, allowing for greater opportunity for someone in that sector.
Gotcha. Okay. And Councilor Flores, you're having a problem with that?
No, no problem at all. I didn't hear the motion. So
she didn't make a motion.
Mayor, I'll second that.
I know she didn't make a motion. She didn't make a motion. I'm giving Councilor Flores a hard time because she likes to jump in front of people.
Yeah, I do. I love to jump in front of trains too.
Okay. Okay, so you're okay with that then?
I'm okay, but there wasn't a motion.
Okay. No, I got you. Oh, so was your proposed, if you were going to do a motion, was it going to be similar to this?
My motion?
Yeah, the one that you were talking about doing, was it going to be something?
No, mine is to add employee.
Oh, add employee. Okay, can you?
The motion hasn't been made. These were just.
Okay, gotcha. I got you. What specifically? What do you mean add employee? What is it now, and how is it you want to change it?
Okay. So my question for Councilor Abetas Dewey is: did you make a motion?
No, we're not there yet. No, we'll get that. Well, I'll get to her. I'm just asking you, since yours is a different discussion, right?
No.
You said you want to add an employee. So is
Yes.
When you're saying, is it an employee of the healthcare? Is that what you're talking about?
No.
Oh, okay.
And a member of the employment force or employment community. That would be the language.
Okay, under employment community, what does it say right now that you don't?
It doesn't have that. It would be another member. So instead of 7, it would be 8.
So you want to add another member and just put specifically of the employee community?
Yes.
Okay. So Councilor Abetas Dewey seems like it's going to be pretty simple. Let's go to that real quick and get that off the floor. So Councilor Abetas Dewey, you want to make an amendment on striking the word nurse out of the healthcare representative?
Thank you, Mayor. Yes, I would like to make a motion to strike the word nurse out of the resolution. That way we can allow for greater availability for people to apply.
Okay, so there's
seconds it.
Okay, so motion made by Councilor Abetas Dewey, second by Councilor Sword, to basically strike the word nurse and just make it read healthcare representative, correct? Okay. Any questions on this amendment? Okay, seeing none. Christine?
This is on the motion to amend Resolution 20-161 to remove the word nurse from the membership. Councilor Abetas Dewey?
Yes.
Councilor Vasquez?
Yes.
Councilor Bencomo?
Yes.
Councilor Sorg?
Yes.
Councilor Flores?
Yes.
Counselor Gandara?
Yes.
Mayor?
Yes. Okay, so that's been passed. Now let's get back to Councilor Flores about the possibility of adding one more person from the employee community. So, Councilor Flores, when you say employee community, they have to specifically be an employee. They can't be an employer or owner or anything like that. What specifically were you trying to get at when you say employee community?
By employee, I believe means that someone who is employed by someone, and that person is not the owner, or but is an employee who has to report to work, earns his or her wages by being an employee.
Okay, does it have to be from a business, or can it be an employee of even of a nonprofit? Let's say
it could be. It could be they would have to be from the business community.
A business community. Dr. Payades, did you have a comment? I see your hands up, or did you forget to put it down?
My apologies, Mr. Mayor.
Okay,
Forgot to put it down.
No problem. Okay, so getting back to Councilor Flores. Okay, so basically then you just want to have an employee from the business community. How about that? Is that what you're wanting?
Yes, thank you, Mr. Mayor.
Okay, so around that discussion, what?
Okay, so do I?
Yes, okay, go ahead, make that motion.
So I move to amend this paragraph to add a member who's an employee in the business community.
Okay, so there's a motion. Is there a second?
Second. Second
by who? Who did the second?
Mayor Pro Tem Cassandra Gandara.
Okay, motion made by Councilor Flores, second by Mayor Pro Tem Gandara. So now we're going to have discussion. Does anyone have any questions or comments on this? Okay. Councilor Flores, did you forget to put your hand down, or did you have something you want to say? No? Okay, if there's no questions or comments, it's okay. If there's no questions or comments, Christine?
This is on the motion to amend Resolution 20-161 to add a member who is an employee from the business community. Councilor Beta-Stuvey.
Yes.
Councilor Vasquez.
Yes.
Councilor Bencomo.
Yes.
Councilor Sorg.
Yes.
Councilor Flores.
Yes.
Councilor Gandara.
Yes.
Mayor.
Yes. Okay, so we've had two amendments passed. Now we're back on the main motion. Is there any questions on the main motion that now includes a healthcare representative and a member from the an employee from the business community? Seeing no questions, Christine, on the main motion, please.
This is on the motion to approve Resolution 20-161 as amended. Councilor Beta-Stuvey.
Yes.
Councilor Vasquez.
Yes.
Councilor Bencomo.
Yes.
Councilor Sorg.
Yes.
Councilor Flores.
Yes.
Councilor Gandara.
Yes.
Mayor.
Yes. Okay, well, thank you, Dr. Payades, and thank you, Councilor Bencomo, for, I know this was one of your initiatives, and the rest of my colleagues for your input. I believe we've concluded our meeting, and so with that, I'll entertain a motion to adjourn.
So moved.
Who was that? Bencomo? Councilor Bencomo? Okay.
Second.
I'm sorry, second by who?
Cassandra Gandara.
Okay, second by Mayor Pro Tem Gandara. Okay, all those in favor signify by saying aye.
Aye.
Opposed?
Aye.
Okay, we're adjourned. It's 11:45 a.m. Have a great holiday weekend, and stay safe.